especially when they know the stories of war, they know the stories of comfort women and being conscripted to be comfort women in the Philippines. And when they come here, doctors don't know that story. And so I think that there's an important synergy that needs to be done, but I'm wondering about the nuts and bolts of how we do that. Here, a year ago, we did a partnership with the Filipino community to get the nanas and the tatas to come to show them the graphs of health disparities related to breast cancer and to ask them what do they think. And I think we need more skilled people who are sensitive and respectful to the community to begin to document that and to have the community own that process and have the community interpret that and have the community tell their own story, to us and be part of that. And so in the guiding principles, I wonder where that would take place. And so I had the opportunity, as some of us in this room have had, to meet Dr. John F. Kerner. He's with the Division of Cancer Control and Population Sciences from the National Cancer Institute. And he says that it takes 17 years to turn 14% of original research to the benefit of patient care. And when you add language access, class differences, comfort women, and that's your grandmother, she never talked to you about down there because she was a comfort woman in the Philippines. These are stories when we go in. I'm wondering, how can we support your leadership and the leadership of our faculty in the Department of Public Health Sciences and the students who are coming out and doing their work? I think that it should be the other way around. We should be meeting with these people and have a spirit, inquiry-based learning, not problem-based learning, as School of Medicine has, and start with some of the real problems that are affecting them. Because I can tell you, now that I've walked the pavement with the union leaders and the hotel workers, now that I've been doing line dancing, in Kalihi, I get a lot of phone calls right now about I lost my job, what can I do? The Cuneo workers, Del Monte, we need to be partnering with them. And they would not come to a health workshop. It's a very low yield to have those health workshops. And so we have to go to them. I can go to any open market and they'll tell us what they need. And I would love to see that turned around so that as students go out into the community and work on real life issues, and you come back and then you find out, what in epidemiology, Dr. Katz, do I need to, how can I tell a woman, about hepatitis, and how do I explain the epidemiology of hepatitis, and so that she will go. So again, I have a lot of questions, and I'm here to support the leadership of everyone here. And from the community, we're dying out there. Filipino women, since the year 2001, Asian women in general across the country, their #1 cause of death is cancer, not heart disease. Although in Hawaii, Filipino women have the highest percentage of death due to cardiovascular diseases. So there are many, many questions, and I think there are many opportunities, and I'm concerned about money. Just like families out there, I'm concerned about money for school. I'm concerned about money for students. I'm concerned about getting culturally competent faculty who know how to talk to community, how to talk to students, and how to present at conferences the results of their research. So thank you, and I look forward to learning more about how we can preserve public health, upgrade it, and not lose it. There's one model to look at it. It frightens me if the model would be that the School of Public Health or public health would be the 13th concubine in a harem, because we know that we won't get very many resources and not much access. And what I would like to see is another model. And I don't know what that is. Thank you.
Thank you, Charlene. Our final speaker today is Nancy Kartika. Nancy is a faculty member that recently joined us actually in 2007. She serves as Director and Principal Investigator of the Maternal and Child Health Leadership Program. Nancy is also currently the President of the Delta Omega Psi Gamma chapter and is a 1979 graduate of the School of Public Health. So Nancy, please.
I'm speaking today not only as a faculty member, but as Jay mentioned, an alumnus of the School of Public Health when it was the School of Public Health. And it was a very dynamic place to be, as many of you know, because you were around at that time. My opinions are really based on 30 years in public health here in Hawaii, having worked on both the health and the medical side in the community. I do want to note first of all, that I think that public health and medicine are distinctly different disciplines. And there is actually a handout over there. I'm not going to go through all the differences. I think there are some opportunities for collaboration, but I think in terms of training and perspective, health and medicine are different disciplines, and they need to be respected equally. So I want to say that from the outset. I do want to point out a historical context here for those of you who were not around during the closure of the School of Public Health. The School of Public Health was eliminated from the university budget in 1999 because cuts had to be made. So the School of Public Health was felt to be marginal in its performance at that time, and it was easier to cut public health than law or medicine or social work, all of which were potentially on the chopping block at that point in time. If you were here at that time, you would have felt that. The issue of whether or not public health education is essential and to what extent it's important did not factor largely into the closing of the School of Public Health. It was an economic decision, it was a political decision. At the time it was closed, the state legislature and the Board of Regents made it very clear that they wanted to rebuild a School of Public Health at a later point. That is why we have an Office of Public Health Studies with level 5 funding now. So there was an intent at that point in time to rebuild a School of Public Health. In 2008, the state legislature passed House Concurrent Resolution 94, which did support rebuilding of a School of Public Health by 2012. It received broad bicameral support from the state legislature. Our new chancellor, when she began in 2007, indicated support for rebuilding a School of Public Health. All candidates for the dean position at JABSOM were reportedly advised that support for rebuilding a School of Public Health would be an expectation of the new dean of JABSOM. Hawaii